Lauren, the resource nurse here.
I'm very slouched.
Oh, we just heard your call bell going off, so this
Yeah,
is perfect
that's
time.
why.
Is that what you were calling for?
Yeah, I just
Okay.
sit down and
Perfect.
it's hard for me to do it myself.
Alright, you know what we're gonna do first? We're gonna just put the bed up nice and high in the air so it's at our waist.
Okay. This is for our safety. Okay.
Because if we were going to move her with like bending, if you're gonna lift her like this,
Yes.
you would be bending at her waist, and that would really, really strain your back.
Okay.
I don't know if you've ever had any work bending over, but it's really sore.
We're gonna lower Paula's head of the bed so we're not fighting against gravity almost. This is really high up. Okay.
And we have this lift sheet in place, as you can see. This is gonna be what helps us move her up in bed. You know, we need something to prevent friction and shear,
Okay.
and
Because we don't want her skin breaking down while she's here. She didn't have any
Exactly.
issues before, so we
Yeah.
want to keep it that way.
And
So we just hold on to
we
this.
never put the side rails down when the patient is not alone, but because we're right next to her, and we would have to lean forward over them,
Yeah.
we're gonna put them
Okay,
down.
that makes sense.
And
Because
both of
again,
us are
it's
here
trying
for
to
safety
prevent
purposes.
Do you need me to help you or?
No, you just kind of hug yourself.
Okay.
And then hopefully you can lift up your head a little bit as we're coming closer to the pillow.
That's perfect.
That's perfect. You don't have to do that right now.
Okay.
So I'll rub on
We're
here.
gonna count to 3 and then scoot you up.
Okay.
So make sure you're, okay, so where's your feet?
They're
Should be
shoulder
shoulder
width
width
apart.
My back's straight and I'm
Bending
bending
at your knees. Perfect.
Keep that line straight.
And stay nice and close to this bed.
Okay.
Alright, we're gonna count to 3 and then we're gonna boost her up because we work
Okay.
as a team.
1,
2,
3.
Great job.
Okay.
And see how that bed was locked? If that bed hadn't been locked, she would have gone quiet.
Into the room.
And now her bum is in the middle of the bed with her bends instead of her back.
Okay.
So
Now we're gonna put the side rails up. For safety. We never want her to be able to fall out of bed accidentally. You want her head back up,
Yeah.
Paula?
You actually get me out of the bed into the chair.
yeah,
Oh,
for
you'd like to sit
breakfast.
up for breakfast? Okay.
Sit in the chair with your tray.
I feel this.
Another thing is too, we always wanna keep the bed low when we're not in the room.
Okay.
Because if it was high,
Yeah.
the
You don't
patient
want
would
her trying
easily
to climb
fall.
out of bed.
So that's a big safety thing, so.
So before we get you out of bed for breakfast, your socks here are a little slippery for the hospital floor, so we're gonna give you some of these non-skid socks. Do you wanna help put them on, Leanne? Sure.
And I'll put up that fall risk sign.
See the rubber?
Mm-hmm.
You can take these home, so if you don't have slippers or
Awesome.
anything, they're perfect. There we go.
Thank you.
Okay. Oh, and that's her fall sign,
Fall sign.
so people will see that.
Alright. So we're gonna have you come to this chair right here. So you wanna make sure this is a good chair. It's locked and it's got nice handrails here for her.
Okay, Paul, we're gonna have you scoot to this side of the bed
I'm gonna
and
just put
dangle
the
your
side rail
feet
down.
on the edge.
Okay.
Do you need a little help sitting forward?
Maybe just a little.
Okay.
So make sure you push from the bed.
Am I doing my feet right?
Push, yeah, push from the bed. There you go.
Oh, okay, that's easier.
Nice and easy to the edge of the bed.
Okay, so let her sit for a minute so she can kind of regain composure.
We're dangling her basically. This is what that's called. But you always have to make sure you're right here with her because if she went forward, she would fall.
Okay. And now we're gonna put this gate belt on. We don't want to be pulling on Paula's arms or her legs when we get her up.
Okay.
So this gives us a nice center of gravity
Mm-hmm.
to kind of lift from.
Awesome.
So this just wraps around your waist. Is that too tight?
Nope.
Okay, Paula, you ready to get up? You feeling okay?
I am. Do I hold
Gotta
this?
always
You
ask
hold
if she's
this?
dizzy, short of
You
breath.
can hold on to our shoulders. We're gonna hold on to this.
Okay.
And I want you to push from the bed,
And up.
okay?
Okay.
We're gonna count to 3 and then we're gonna
Okay.
stand.
Okay.
I'm gonna keep my feet shoulder width apart and bend at my knees.
Back straight.
Okay.
Okay, ready?
So
1, 2, 3. Good job. Now we're gonna step.
now pivot. Sarah, do you have the chair ready?
Yep, I'm gonna just pull it a little bit closer.
Stand here.
Feel it at your knees before you go ahead and sit.
You feel it?
Mm-hmm.
Reach for the side rails. Oops, sorry.
There we go.
Very good. Great job.
Thank
How are
you
you
guys.
Yeah.
It's very hard to do on my own.
Yes, absolutely.
Just make sure you always call for help.
Here's the table for breakfast.
Thank
All
you.
right, and we'll get you that call bell.
Here's your call bell.
All right, we'll pull this nice and
Okay.
close for you.
This is good.
Yeah, you ready for breakfast?
I am.